Northeastern Pennsylvania Healthcare Foundation celebrates its 2014 grant recipients. Organizations working to make a difference in improving the health and wellness in Lackawanna, Luzerne, and Wyoming counties. Listen as they share their impact in our communities.
TCMC was founded by this community, and it was founded for the purpose of training future physicians who hopefully will return to practice in this community, and also to improve the healthcare in this community. And we take both of those missions very seriously. We are particularly proud of the fact that 23% of the students at TCMC are the first generation of their family to go to college, let alone medical school. Medical school everywhere is very expensive, and medical students face a huge burden of debt, which is typically about $180,000 by the time the average medical student graduates. And it is a huge obstacle to people of limited means. And so we're very excited and very grateful in creating these scholarships aimed at students from these very counties right here, and particularly students of need who have declared an intent to return here to practice when they're finished with their training.
Volunteers in Medicine is truly a community-based nonprofit organization. We provide free services, medical, dental, counseling, and specialty services to the working, low-income, uninsured. This grant is going to assist our free dental clinic. The dental clinic opened in January of 2011, a few years after the medical side, and has become a very high demand resource. The funds from this grant will help us with staffing, will help us with purchasing the needed supplies that are very costly, and even equipment. So it's ultimately going to help us treat more patients.
The patients become so close to us that we become a dental home to them, and we become like a practice in our own little community in serving those in need. And it's here to give to the community for the uninsured, underinsured. It's very important to give confidence to those patients and to provide them with not only the oral health care, but also their self-esteem and their appearance. This will make a huge impact on our center, on our dental clinic. A little under 50% of the money that will be given to us as the grant will be provided for the unemployed. The other 50% of that money will be going towards the one-time investment for our equipment.
Pipeline programs that expose young people to health careers and encourage them and support them as they look to what they're going to do in life are so important, especially in an area like ours. And it works to increase the workforce, the health workforce, to bring young people into healthcare in a variety of fields, to place medical students and other health profession students in rotations in rural and underserved areas. One of the programs that this grant is funding is called the Traveling Trunks Program, in which our staff goes out to schools and they have a variety of interactive tools where they can expose young people to the different health careers. So we're so grateful to the foundation for its support for our core mission.
Our concept really is to help youngsters learn about careers in the region. And there's about 7,000 jobs in the healthcare industry in the 5 northern tier counties, so it's a pretty important part of our local economy. But students really, in most cases, have very little idea around what opportunities there are in the area. We have 3 major focuses this year. One is the healthcare career event. We can handle about 220 students at a time. The other one we do is we're going to do the summer camp in June of this year. And the other one that's going to help us do is the internship program that we're piloting this with Tyler Hospital.
The National Alliance on Mental Illness is a grassroots organization, and our primary purpose is to educate and advocate. So we educate the public to try and reduce stigma. We're offering 2 programs. There's a family-to-family program, which is a 12-week program, runs 2.5 hours per session. and that is designed to educate family members on the best way to handle their living situation with the person in their life with mental illness. The other program we are offering is the peer-to-peer program, and that is offered to those with mental illness, and that's also designed to help them develop a support group.
Children's Service Center is a 153-year-old nonprofit. Since then has become a kind of a leader in behavioral health services for children and families. What we asked for support with was the Parent-Child Interaction Therapy Program, or PCIT. The nice part about it is you're really working with the families directly on their parenting skills. So the impact that you have with that family, with the child that's been identified, not only helps that child, but it also helps the other kids that the parents have. We've seen great successes with the model. We've seen parents that have come to us at wit's end, not knowing what to do with their child, and 10 weeks later, walking out feeling amazingly comfortable and confident in their skills.
We continue to ask the question, what does the community need that we possibly can respond to? What do we have the resources? And so most recently we have the example of the Trinity Child Care Center, where we were able to say, we have experience in being able to assist families when they have a child with special medical needs. The funds from the Northeast PA Healthcare Foundation really allowed St. Joseph Center to begin a program. Trinity Child Care Center helps the whole family, but it's unique in the sense that the child is coming from home. The parents continue to be able to meet the child's needs. It welcomes the child for day services, and the child does return home at night, and it's medical care throughout the day.
Our mission is to ease the burden of cancer in northeastern Pennsylvania, and we pride ourselves on working really hard to evaluate what the needs are in the community. Well, the community-based patient navigation program is a screening initiative. Since its inception in 2010, we've been able to facilitate over 1,490 completed screenings for breast, cervical, and colon cancer. So this particular grant helps facilitate potentially life-saving screenings for colon, cervical, and breast cancer among those of us that don't have a lot of resources. And we also work hard to connect those individuals to a medical home so that it's not just a one-shot deal with those cancer screenings, that for ongoing preventative cancer care in general.
Lou Rusby Jr. Foundation is a nonprofit foundation, and our main goal is to provide educational seminars in schools. The organization started about 6 months after the passing of my brother, Lou Rusby. The need in the communities is huge for suicide prevention, especially in the schools. Our teachers spend more time with our students than their parents do, so we need to educate them on the warning signs, the symptoms, the red flags, and what to look out for in their students. The funding from the foundation that we received is going to be huge. We're able to keep the programs that we have in place with the current school districts, but the best part about it is we're able to expand.
The Leahy Clinic has dual goals. We are here to bring the University of Scranton's Jesuit mission to our students and teach. Where our equal goal is to help the community, the marginalized, the people who are uninsured. We're unique in that we have a large body of students that are second language speakers. So we've developed a program where those second language speakers have learned in the classroom medical translation. This funding is so important to us because it really allows us to sustain what we're doing. It allows us to improve on projects.
The Lackawanna Heritage Valley is a National Heritage Area. One of the biggest projects that we're currently working on is the Lackawanna River Heritage Trail, used for running, walking, biking. With the program that we're starting to implement, the bike share program, we're encouraging more and more people to get out and get on a bike and try to take on a new form of exercising and recreation by getting out and on the trail. We wouldn't be able to do it without the grant. That really planted the seed money for us to go out and purchase the bikes and the equipment that go along with them.
The Deutsch Institute was started in 1979, started with a group of volunteers in the city of Scranton that looked around and saw that people with physical disabilities didn't really have an outlet for recreation or leisure. Well, I think because we see the folks that we work with have a tendency to have some high-risk health concerns. Unfortunately, a lot of the folks that we work with tend to have a sedentary lifestyle. The grant that we received was adaptive fitness. So we have targeted local day programs for folks that have intellectual disabilities and possibly some physical disabilities, as well as a dual diagnosed population.
The Luzerne County Child Advocacy Center is a place for children to come who have reported abuse. They can come to our center, they can be interviewed by a forensic interviewer who is a trained person to speak with children regarding abuse. They can also receive an exam at child advocacy centers, and then at that point they can return home or to their foster family, wherever they are safe. The grant money that we received actually will help us to have a full-time forensic examiner on staff at our center at all times. Every time a child has to repeat what happened to them, especially younger children, they get re-victimized and they have to relive everything over and over again. So here they tell their story once, it gets recorded on a DVD, and then if anyone has to do any follow-up questions or talk to the child, you can just review the interview that was already done.
The Dietrich Theater is a nonprofit movie theater, and we use our revenue and other support to provide cultural and educational opportunities for the region. I looked at the statistics in Wyoming County, and from all the age groups, there's so many benefits that we can gain through health and wellness programming. The funding through the Northeastern Pennsylvania Health Care Foundation has really filled a need in our community. It's allowed us to bring a variety of health and wellness opportunities to all ages. For instance, we have nutrition classes for adults. There will also be drug and alcohol awareness presentation in May, and we also will be offering chair yoga throughout the year.
My program at the YMCA is a cardiopulmonary wellness program, and we see patients 3 times a week. And we institute 30 minutes of cardio along with 30 minutes of strength training. We give them education on nutrition. We do a whole health history on them. We look at their medications, and we talk to their doctors by giving them reports. It brings a lot of things to a social place where people would go to exercise and not think to find health care. And also we give scholarship, and that's what this grant has allowed us to do.
We provide support services for victims and their families, and this is a whole range of different support services, everything from crisis intervention. We have a crisis shelter that women and children escaping from a violent situation can come in and take refuge with us, and then a huge range of support services, counselling support, legal support, any kind of support that a victim and their family might need to help them get to what we call a violence-free future. This funding is going to be absolutely essential in helping us overcome a lot of the barriers that our victims have, helping us to renovate our much-needed facilities and look at expanding our services. So being able to give someone the light at the end of the tunnel and be able to say, look, there is help out there, we can support you, we can get you out, and we can help you move forward.
We serve a niche in our community with meals for those that are at home, frail elderly, those individuals that need nourishment. Nutrition serves a tremendous role in keeping someone well. So the home-delivered meal for that individual is a boost to their overall well-being, to their immune system. This grant enabled Meals on Wheels to address an unmet need, to bring food, meals to individuals in their homes that were hospitalized. So it's the Transitions Hospital to Home Meal Program.
Candy's Place was started in 1998 in memory of Candy Vincent Mayberry by her sister Penny Cunningham. We provide a variety of services for anybody that's currently in their cancer treatment and for 1 year post-treatments. So all the services that we provide, they all complement the treatments that a cancer patient may be having. With this grant, previously we were only able to use the program for breast cancer survivors. Now we were able to open it up to all cancer survivors. So there's men and women in the program. They meet with a
trainer once to twice a week, and they're assessed in the beginning, the middle, and the end of 12 weeks.
Well, the goals of In the Cardiac Direction are to make people independent in their health care. It's to bridge the gap between what happens in the doctor's office and the real world. We let them understand how important it is to be compliant in changing certain risk factors, implementing certain changes in their life according to their risk factors. Well, this grant allows us to be able to keep the program going, and it affords us to keep the costs low. And education is a big part of what we do also. So they're learning while they're exercising, and it's a very friendly, happy environment.
Seven Loaves is such a wonderful asset for people who need food. And we're there to feed people 5 nights a week. We give them fresh food, we give them lots of variety, and we feed approximately 40 to 60 people a night, people who would not have access to a good, wholesome, healthy meal. The grant in particular helped us to purchase a new refrigerator. We have organic farmers who give us potatoes and rutabagas and unusual vegetables, but we now have a place to store them and keep them safe and keep them at the right temperature so we can use them when we need them.
We are a nonprofit charity that turns no one away for an inability to pay, and we serve everyone from 6 weeks old to older adults. The community is really starting to see us as a leader in chronic disease health. We have cancer programs, diabetes programs, adult obesity programs, teen programs. The bulk of those are all offered at no cost. So this grant from the Healthcare Foundation is going to support Livestrong at the YMCA. It's a free 12-week cancer program. It's going to support diabetes prevention programs we offer at RY, which are again free, that we provide to our participants. The grant's going to support Healthy Families, Happy Families. That's a free 12-week program we offer for families from our community. And it's going to support Road to Wellness, which is an adult obesity program.
It's pronounced Pays Back. The initials represent physical activity intervention for surviving beyond cancer. 2 things that were essential to me when I was creating the Pays Back program were that it be free to participants and that it be individualized versus a class, because everybody's coming in with vastly different capabilities and limitations, and even the well-insured are meeting with financial hardship around cancer. The funding from the grant has been huge in allowing me to continue the program over the next year.